Hi, today I'm making a short video on betrayal trauma. So people might wonder, what is betrayal trauma? It's not a trauma that you hear about often unless you've been betrayed. Then you might recognize some of the symptoms we talk about. So first of all, betrayal trauma is usually associated with infidelity. However, there are other instances that betrayal trauma can show up outside of infidelity. For example, somebody may be hiding addictions and their loved one finds out about it. They might be actively engaged in chronic deception. And when the betrayed partner finds out about either the addiction or the deception or the infidelity, it shakes their reality. They have a really hard time questioning what's real, what wasn't real. They question their self-worth. They experience grief, anger, depression, anxiety, in some cases even PTSD. And so my job as a therapist is to aid either the couple, if they've decided that they're wanting to work together, or the individual, or both, in their recovery, in their healing, so that navigating day-to-day life becomes manageable again. Some of the ways that I do this in therapy is through a couple different modalities. I use cognitive behavioral therapy a lot, which is how the thoughts that I have affect my behavior and kind of understanding the correlation between them. I do somatic therapy in office a lot. That involves body work, calming the body down, right? Because even though our betrayal may have happened in the past, even, year, 2, 3 years ago, our body will react as if it's happening in present when triggered. And so we work on calming the body through mindfulness exercises. I'm trained in EMDR, which for some people is a necessary part of their therapy because the trauma is impactful enough that they are stuck in it, and we use EMDR to process the areas that they're stuck in and to be able to desensitize our bodies to it. I also utilize dialectical behavior therapy because we are human, and sometimes we think in all or nothing. We call those cognitive distortions, and sometimes that's how we think. Oh, they cheat, I'm leaving. Well, when you come across people who have been cheated on or have experienced betrayal trauma in other ways, they still might want to stay in the relationship with that partner. And so dialectical behavior therapy is helpful in helping to take two things that seem like they might be opposites and coming together in the middle, right? I can have experienced infidelity in my marriage and still in the end choose to work with the partner who's hurt me, and still in the end, after lots of therapy, have a healthy relationship again, right? It doesn't have to be either or. So DBT is very helpful for that. If this is an area that you find yourself experiencing, please give me a call. I have additional training in betrayal trauma, and I am trauma-informed therapist, meaning my goal when we work and do trauma is to make sure that it's in a safe environment so that you do not become more traumatized dealing with your trauma. And so if you would be interested in working with me, you can reach out to me. My website is www.goldencounselor.com. On the website, you'll have a lot of information about betrayal trauma and the other types of trauma that I do in therapy. It also has answers to questions you might have in regard to couples work or grief. The other way that you can get a hold of me is just either calling or texting me at 480-269-7504. And you can always email me at Tanya, Tanja Romney, ROMNEY @goldencounselor.com. Thanks.